La bienvenue ici au webinaire du département de médecine de famille et de l'école de, oh my goodness, I don't think I can say it in French, the School of Population and Global Health at McGill. So this webinar series is part of a joint effort between the Department of Family Medicine and the School of Population and Global Health at McGill. And I am delighted to welcome you here. I am Marian Dove. I am chair of the Department of Family Medicine. And this webinar is one of a series that has been put on jointly. So we're thrilled to see so many people here today. I personally am thrilled because, as I was saying a bit earlier, I have a daughter who is a climate militant and it's like I live with the environmental police at my house. I buy all my clothes at Renaissance secondhand, and I still buy too much. I'm still consuming too much. So just to say, I'm a little bit traumatized by the environmental police in my house, but that's okay. I think we all need more of that. So today we have three wonderful speakers, and I'm going to introduce them all, and then I will be turning the floor over to Shashika Bandara, who is going to be the moderator for today. He's one of the graduate students in our department. So welcome to all the speakers. Dr. Claudel Pétrin-Desrosiers is a family physician at the CLSC de Hochelaga-Maisonneuve and head of planetary health for the Department of Family and Emergency Medicine at the Université de Montréal. Since 2018, she has been the chair of the Quebec Association of Physicians for the Environment. A TEDx speaker in 2021, she was also recognized as one of the 100 most influential women in Canada, according to the Women's Executive Network. Professor Deborah McGregor is an associate professor and Canada Research Chair in Indigenous Environmental Justice at York University. Professor McGregor's research has focused on Indigenous knowledge systems and their various applications in diverse contexts, including water and environmental governance, environmental justice, forest policy and management, and sustainable development. She co-edited Indigenous Peoples and Autonomy, Insights for a Global Age with Mario Blaser, Ravi DaCosta, and William Coleman in 2010. Dr. Ingrid Waldron is a professor and Hope Chair in Peace and Health in the Global Peace and Social Justice Program at McMaster University. Her research, teaching, and tireless advocacy focus on the structural and environmental determinants of health and mental health disparities in Black and other communities. Dr. Waldron is the author of There's Something in the Water, Environmental Racism in Indigenous and Black Communities, published by Fernwood, which was turned into a 2020 Netflix documentary of the same name. So welcome to all our three speakers, and I will now turn the floor over to you, Shashika, to moderate the discussion.
Hi, everyone. I'm super excited to have this conversation with our expert panelists, and I welcome the panelists, and I want to say that this is a much needed topic that doesn't get attention. And let me quickly set the scene so that we are all on the same page. So in 2019, it was considered the warmest year on Earth. And because of the pandemic, the temperature has gone down because our activity has gone down, but that does not say that we have averted the disaster levels. And the UN Sustainable Development Goals is focused on climate action, but then also there's UN recommended actions that would help us avert this climate crisis. What I do want to highlight is that this is not an abstract concept. It's not just about temperature. It's about communities. It's about how we interact with each other. It's about colonization, how we relate to communities and make it sustainable moving forward. So that is where our speakers come in. They work closely with communities, as you heard in the introduction, trying to course correct where humanity has gone wrong. So, having set the scene here, so I will just, we will have maybe 2 to 3 rounds of questions, and then we will move on to the Q&A. So Deborah, I'll start with you, if you don't mind. I know you work focus on governance challenges related to water, environmental justice, and forest management, and so on. So currently, communities are affected, but also we are also in a situation where we continue to ignore these challenges, and it needs to be put on the agenda. So having worked on this area for so long, I want to ask you, what are the major challenges that you see from a perspective of governance and also from the perspective of communities affected?
Thank you. Thank you for that question. And first, I thank you for having me. And I am zooming in from Toronto, so the traditional territories of the Haudenosaunee and the Anishinaabe and the Wendat people. So I'm Anishinaabe, so I feel like I'm still speaking from home. And I'm happy to be on this panel because I know Ingrid and Claudel. So it's I don't think we've ever been on a panel together, or maybe there's just too much going on right now for me to remember what's what. So thank you for having me and being on this panel. I'm going to learn a lot for sure. So in answer to the question, I think I'm going to look at it from the perspective of when I find myself in what I call these different like climate change kind of circles, either with the Assembly of First Nations, with the Climate Change and Environment Coordinating Committee, or with Climate Solutions on the adaptation panel there. So I find myself in these different circles where there's very specific ideas about how climate change is understood and experienced, how what the cause is, what exacerbates different conditions in these particular circles, because there's a lot of them. And as I find there's some places that people don't really like to go, and they often deal with issues around equity on injustice, particularly in relation to Indigenous peoples. And I think partly because there's not a lot of, I guess, simply put, a lot of knowledge really about Indigenous peoples. Where would people have learned this, right? Like so many times when I'm teaching, students will say, I never learned this, all the way from K to 12 or even in undergraduate. So a lot of the times people just, they don't know, like they don't know the reality of Indigenous peoples and the diversity of that particular reality. So in relation to health, and others may comment on this as well, is Indigenous peoples are starting from a place of health disparities to the rest of the Canadian population for a number of structural and institutional and legal and constitutional reasons, actually. And so you're starting from this place, and it's very difficult to address when it's something like the Indian Act, which is a law, or other kind of laws that come in and don't recognize Indigenous peoples, their rights, governance, and self-determination. So there's that to start with. So there's human rights issues, there's the Indigenous rights issues, self-determination, which is recognized in the UN Declaration on the Rights of Indigenous People. So what this means in terms of the ability to be able to adapt, so in the other kind of circles I found myself in are the climate assessment circles. And a couple of years ago, I was asked to contribute to an IPCC report that just came out. So as a contributing author, and I was asked to look at vulnerability and risk to Indigenous people with climate change in relation to water for Canada, US, and I had 400 words to do it. That's how it works. And you're trying to explain the breadth of the impacts on Indigenous people, what the risk and vulnerability is in this pre-existing situation in terms of health, but also in terms of infrastructure, in terms of governance, lack of recognition of rights, all impacts people's risk and vulnerability and ability to be able to adapt. But one of the core reasons, to answer your question, is because Indigenous peoples are structurally impeded and legally and constitutionally from being able to govern what's happening in their communities. Often the situation is other people have solutions, which is great, work on solutions, keep doing that. And then they get imposed upon Indigenous people. This must be the solution for you, even if sometimes it doesn't make sense. I've been in places where I've said that really doesn't make sense for a fly-in community up in Northern Ontario, which is basically in the Arctic lowland. Like that solution makes no sense there at all because people just don't know that reality. So then Indigenous people have put their energy into sometimes resisting some of these solutions, which I'll talk about when we answer the Sustainable Development Goals question. So really impedes the ability to be able to, when you can't really adapt to the situation in the way that you would want in terms of governance and self-determination. So this again leads me to another climate assessment experience. And I hate to say it, but still Indigenous peoples are to add on to these, like they're asking us the last minute. This one we had 3 weeks to, and I think we had 2 pages. There was a number of us, maybe 8 people in the contributing author team, to talk about Indigenous people and climate change in Mexico, Canada, and the US. That was fun. And one of the things that we identified that we weren't seeing as part of the IPCC reports or climate assessments was that very question that you asked, self-determination and governance. It was really, really hard to find material because for these IPCC assessments, you have to work with peer-reviewed literature. You have to work with certain things need to be in the title because they're trying to convince nation states of things, right? So when these assessments are done, so they need to have all this evidence. And but if people didn't ask the right questions, 30 years ago, 40 years ago, 20 years ago, 10 years ago, then we don't have that existing data. So it was really, really hard to find data on, okay, what about Indigenous people, climate change and adaptation? There's a bit of it. And what it basically says is, so part of it is Indigenous people experience climate change differently. Almost every sort of bad, unwell situation in Indigenous communities gets exacerbated through climate change. And but you experience it differently. You don't experience it in silos. The way that people study this, that's pretty well set. Like how you study, climate assess, vulnerability and risk, mitigation, monitoring, adaptation. They're all very siloed. Very specific scholars and scientists work on these. That's not how people experience it. So the solutions that are very based in these silos don't really respond to the needs in Indigenous communities. So they need to govern on their own terms. They also understand climate change differently, and understand climate change to be a continuation of environmental change and intensified colonialism. So colonialism is that word in these circles that I'm in that people don't like to hear. They don't like to go, what does that have to do with climate change? So historical and ongoing creates a lot of these conditions. So Indigenous peoples want to govern their own situation, generate your own solutions. And there's this tension, I'll describe it as a tension, where connection to the land, on the land activities is hugely impacted by climate change. Like what happens to water, what happens to the plants, what happens to food, everything is hugely impacted by climate change and pretty well recognized at every level. Indigenous peoples have a particular close relationship to the land. Your culture identity is derived from the land and waters around you, the natural world. But it's those very same things, that way of life is a very thing that builds resilience. And you're also governing. So when you're on the land, you're governing and you're mitigating. So it's a very kind of holistic kind of perspective that's not really captured, I find, in the climate change world that I find myself in. So, but Indigenous peoples are doing something, but that's maybe another question later that I'll stop now and maybe we do the fireside chat because I did a recent search because I'm part of Canada's the Natural Science Climate Change series on a specific Indigenous resilience report. And I worked on this, trying to answer that very question is, what can we find in terms of governance and self-determination by Indigenous peoples that can answer that question? So I'm going to stop there and hopefully I conveyed that there's all these tensions. We're coming into this with a particular set of conditions that aren't going away anytime soon. Like I wish I had a Harry Potter wand and could wave it and say, let's get rid of colonialism, but that's not happening tomorrow or this afternoon. So we have to work in this context. And Indigenous peoples are generating their own solutions to the situation that they're facing because they do understand it, experience it in very distinct ways. Same as other people as well, but there's very particular situation that Indigenous peoples find themselves in. So I'll stop there so we can hear from other folks as well. Hopefully that kind of made sense to people, and glad to chat about it more.
Yeah, thanks a lot, Deborah. I just want to highlight that, throughout Deborah's answer, she highlighted the structural factors that is affecting and sort of has sometimes impeded the approaches that we can take. And so I thought this would be a nice segue into what Ingrid is doing on her work, tackling environmental racism and sort of addressing these structural issues, pushing the government to introspect. So Ingrid, I want to ask you, as we all know, as also Deborah mentioned, environmental racism is intrinsically linked to climate justice, but so if you were to list out, say, the top 3 challenges related to environmental racism, perhaps in particular to Canada right now, what would they be, and what kind of impact is it having on communities?
Yes, so since 2012, I've been conducting a project on environmental racism in Indigenous and Black communities in Canada. And the term environmental racism was first coined by Reverend Benjamin Chavez back in the early 1980s. And basically what it refers to is the disproportionate siting or location of industrial polluters in primarily Indigenous communities and Black communities and other BIPOC communities. And it typically impacts communities that are, as I just mentioned, racialized, that are more likely to be low income, that may live on reserves or in isolated places or rural places. So it's an intersectional issue. You've got to look at the issue of race and culture and education and income and geography. And when you look at those things, you realize that it's typically communities that are lacking in political clout, social clout, and power. So it's much easier to place landfills and other dumps in communities that lack that kind of political voice, or communities that are less likely to be heard by government. It's also about policy. You know, it doesn't just happen. It's not just, you know, it doesn't just happen in Canada. It happens through environmental policies, and specifically through environmental impact assessments. Impact assessments are tools that are used to decide where a landfill gets placed, for example. And in the case of, let's say, Indigenous communities, I would say that environmental assessments have kind of a long way to go, because they are premised on kind of Western models that don't necessarily see the interconnectedness between the land, between people, between animals, between plants, etc. Right? So we know Indigenous epistemology is very holistic. It sees the interconnectedness of these things. So as long as environmental assessments continue to be premised on Western models that don't take into account Indigenous ways of knowing, alternate ways of knowing, then it's always going to miss the mark, and it's going to end up in Indigenous communities particularly, and other communities. We can see tangible examples of environmental racism across Canada. There's Amjinwang First Nation, Sarnia, Ontario, which is often referred to as Chemical Valley. It has over 60 petrochemical facilities surrounding the community. There are health risks in the community because of those over 60 petrochemical facilities, including cancer, various types of cancer, reproductive illnesses, reproductive cancers, respiratory illness. There was also Grassy Narrows First Nation, which had issues around mercury contamination, I believe in the 60s and 1970s. And while there was a kind of multi-million-dollar deal to clean up Grassy Narrows First Nation, I think around 2015, we see the health effects still, right there. The health effects remain. I always say to people, well, yeah, it was cleaned up, but the health effects remain. Wet'suwet'en First Nation, Northern British Columbia, they're trying to halt a multi-billion-dollar pipeline project in that community. And that's the kind of issue I think that has gotten perhaps most attention over the past few years. We can go to Nova Scotia, where I've done most of my work, and you've got Pitulanik First Nation that since 1967 had a pulp mill dumping effluent into Boat Harbor since 1967. That was closed in 2020. We can look at Alton Gas issue, which is Sabaganagadi First Nation in Nova Scotia. They recently, 2021, last year, October, they finally got Alton Gas to cancel the project, and they were planning to kind of build a brine discharge pipeline near the Shubenacadie River. You've got a Black community in Nova Scotia called Shelburne, which has had a dump since 1942. The community got that closed at the end of 2016. You've got Lincolnville, Nova Scotia, which has had a landfill, first and second generation landfill in 1974 and 2006. Still open. Shelburne, Lincolnville, all the communities I mentioned would say that there's a link between extremely high rates of cancer in their community and respiratory illnesses like asthma and the dumps. And then you got Afrikville, a longstanding historical African Nova Scotian community that's no longer, but the descendants are still trying to mobilize to get reparations for being expropriated out of their community. So I think Afrikville, we would say, is an example of expropriation, gentrification, urban renewal, but also environmental racism, because when the city of Halifax was engaged in kind of urban planning in that area, it left a host of environmental hazards in the community, like 3 systems of railway tracks and an open dump. So all of these communities, Indigenous and Black communities across Canada, this is how it's played out. And all the communities would say there are health risks, because you have to look at what is contained within these sites. And that's work that my research assistant did using the EPA website from the United States. You can look at a landfill and all of these different sites, and the EPA will tell you what materials are in those sites. And then it can link that to various health risks, some of them extremely serious like cancer, kidney diseases, etc., and some less serious like skin disease, I guess, if you say that's less serious, and gastrointestinal disease. So the impacts to me are significant. Communities have been trying to address these issues over the past several decades, and there's been some wins in certain communities, but other communities press on.
Thank you, Ingrid. That was a alarming, but also very detailed description. I think we all need to hear it. And I just want to remind that one of the 6 climate positive actions that the UN has recommended is to, which is called green economy, to make societies and people more resilient through a transition that is fair to all and that leaves no one behind. And as we can see, we're sort of way behind that goal globally, and also in Canada and other parts of the world. I'm going to, now that we spoke about the health challenges extensively, I'm going to move on to Claudel, who has sort of worked at the intersection of health and climate change, and has been advocating for the health co-benefits of climate action. So in terms of the health co-benefits, can you explain where the intersection lies and how it benefits the community? But also, I want to ask, since we are setting the scene in terms of challenges, like what would be the biggest challenges that you see at the intersection of health and climate action?
All right, thanks. I'm really glad to be joining you today. I feel honored to share this panel with Dr. Waldron and Dr. McGregor. Followed their work in the last couple of years, and I myself work with the Canadian Association of Physicians for the Environment, and we've been big supporters of the proposed bill to fight environmental racism in Canada. So thank you, Dr. Waldron, for your very important work on this. I've collaborated with Dr. McGregor as well on the Lancet brief that we do every year for Canada. So basically the Lancet is one of the world's biggest medical journal. In 2009, it has issued a report, like I would say it's a must-read piece. It called climate change the greatest threat to health of the 21st century. In 2015, they came back with another report that said that it might be the biggest threat to health of the 21st century, but fighting climate change may be the biggest opportunity we have to decrease health inequities and to improve health globally. So this has been, I would say, that the reason I'm still doing this work today is I believe that if we do fight climate change appropriately, that means quickly, but also with a lot of ambition, we have the possibility right here to improve the health of people here in Canada, but also worldwide. And since 2015, the Lancet has do a report every year tracking the progress on health and climate change. Well, they hope to track the progress. In the last couple of years, they haven't tracked progress much, but they still report on around 40 indicators linking climate change to health. When we say that climate action can improve health, there are several pathways for that. I think it's important to understand that basically climate change as the biggest threat to health of the 21st century is impacting every factor that determines our health. So what we call the big family of social determinants of health. But I want to add to that historic determinants of health, political determinant of health, environmental determinants of health. And when we know that in a city like Montreal, there's up to 10 years differences in life expectancy between the richest and the poorest neighborhoods, and I work in one of the poorest neighborhood in the country, in the city, I find it very revolting that still to this day, we allow this difference to exist in our communities. And that's not because, I mean, there's always a question of access to health, but we know access to health is only about 20% of what determines the health of our people. 80% is the environment that we live in. And this environment is the air we breathe, the water we drink, how we transport ourselves. And we know that only in Canada every year, there's at least 15,000 premature deaths from air pollution alone. There's, I would say, things that kills more Canadian than air pollution every year. So when we talk about climate policies, we often have two types of action in mind. We have mitigation, which is basically trying to reduce our GHG emissions, and we have adaptation. We've tried to do mitigation for a while now. This is mostly what politicians talk about. This is our climate targets. We keep failing them, but this is still what we're trying to do. We're trying to decrease our emission. We've been not so good at it. I mean, we haven't reached a target in at least 10, 15 years. We have these very ambitious targets to decrease by 40% in the next decade. We aim to have to reach carbon neutrality by 2050. This is basically tomorrow. We're not on this track, but even if we meet those goals, we'll most likely still face a warming of 1.5 degrees. And the latest IPCC report from 2 weeks ago basically said that even if we manage to reach to limit global warming to 1.5 degrees, we will still not live in paradise. I mean, we will have deadly heat waves, we will have floods, we will have tropical weather extreme events, we will have malnutrition, we will have droughts, we will have displacements, we will have civil wars, most likely due to political instability. And the only way to reduce this sort of those impacts is to act on adaptation. And we've been very, very bad at adaptation lately. This is not funded. This is not research as much as mitigation is. And this is not something that is getting enough attention from politicians. So moving on to, what are the current challenges? There are a few challenges in this space of climate change and health as I've experienced in the last decade. We have a deficient in adaptation. This is being worked on, at least on the federal level. There's I think Dr. Waldron and Dr. McGregor were both on the National Adaptation Strategy table. If I'm not wrong, but the government of Canada is planning an adaptation strategy. Hopefully it will come out and it will be good. We're still waiting for that, but it's supposed to be coming out in the next couple of weeks. This is at least will be a guiding piece as to what we should be doing. But I mean, provinces should be doing that. In Quebec, we don't have an adaptation plan. In the last governmental environmental plan, which was called a plan for a green economy. Anyways, we can agree what this name is, but is this plan for a green economy? It was less than $10 million went to adaptation. This is basically sense. So adaptation deficit. We also have, I think, a communication problems. We haven't talked much about climate change from a health perspective, but we have research that show that if we do speak about climate change from a health perspective, we are able to motivate people to act. This has been studied across the world, so not only in Canada, but we know that if we mobilize the health argument, we mobilize people, even the ones that don't feel connected to the climate crisis. So people who may be more on the right spectrum of the political ideas. So there's a potential there, and we haven't been so good at this. One of the example that I can name recently is that the government of Quebec has named a committee of 15 people to guide them and provide feedback on their work. In this 15 people committees, there's no one from the health sector. There's not even a doctor, there's not a public health person, no one from the health sector. So how can you implement policies that do track health disparities and health inequities and put health at the core, at the center of a policies as it should be, when there's no one from the health sector in the guiding committee? So just a quick example is we have still a lot of work to do. And I've been in this space for 10 years. It's not, I've been there for a while, but I mean, there's people who've been there for 30 years now, but I've seen a lot of change in the last 10 years, but there's still the need for us to fight for a space in here. In medical schools, in the last few years, I've been often asked, like, why are you doing this? Like, you're training as a family doctor, should that be enough? And the point is not, I mean, I can give pills, but my patient will still be sick. And one of the only way for me to make sure that the practice that I have is meaningful to me is to make sure that I do everything I can outside of the clinic walls to make sure that my patients have the right, well, I mean, they have the right, but are able to live in an environment that promotes and protects their health and is not killing them. And we know, I mean, and I will stop there. I've been speaking for a while now, but I mean, in the neighborhood where I work, for those of you who are familiar with Montreal, Hochelaga-Maisonneuve is one of the poorest districts in the city. It is also one of the neighborhoods with the least green canopy. So my patients don't have access to a lot of trees. They don't have access to a lot of parks, and it's not super well served by public transport. So they live in zones that are prone to urban heat island effect. And when we look at who's dying in Montreal when there's a heat wave, it's a lot of people that are 65 and older that have chronic diseases such as hypertension, dyslipidemia, cardiovascular disease, and people living in Hochelaga-Maisonneuve. So basically someone living in Hochelaga-Maisonneuve has twice as much risks to die in a heat wave than someone living in Westmount. And that's for me enough to be outside in the street protesting when there's climate walks.
Thanks so much, Claudel. That was a great description, and also very helpful to understand what we need to act with a sense of urgency. And perhaps, you know, join the protest that you're on. Let us know. We'll come and support you as well. I just want to sort of bring together the ideas, highlight two things. One is that what Claudel mentioned and what everybody mentioned on the panel is that we are always focused working in silos. So for an example, the SDG climate action goal is number 13. But if you actually look at it, it affects all the SDGs across the board. So number 3, which is related to health, number 1, which is related to poverty, number 4, which is related to the well-being of people. And so many different, at least 10 SDGs are directly impacted by climate change and action, and also environmental justice and so on. So one important thing perhaps to remember as health researchers and so on is the interconnectedness of it that the panel stressed on. And so I want to move forward. And one more thing is that the vulnerability aspect of it is how the vulnerable populations get affected more from these challenges than the non-vulnerable communities. So those two things I want to sort of have in the mind of the audience as we move forward to the sort of the next round of questions. I want to focus, be more action oriented here now that we have sort of instilled a sense of urgency in everybody. Deborah, let me start with you and ask you, now we have the UN climate goals, we have the climate action number 13. So looking at the actions that have been taken so far, how far has Canada come in terms of addressing these challenges, and what more should we do specifically, or you know, at a level of government to address these challenges, in your opinion?
It's a really big question, and as I was reading the questions for the panel, I thought, one, I think we need to do more to see actually how Canada's doing. Like what I did was start to list the sustainable development goals that kind of relates to Indigenous people, like the 6 on water. Canada still has a lot of, let's say, use that one as an example, where they want to where people should, but it's also a human right, have access to clean portable water. So pumping millions of dollars into this whole process to build infrastructure in First Nation communities, which is fine, but at the same time, the other parts of it in relation to climate change, carbon, and everything else is like amping up industrial, like industry basically, and which then contaminates the water. So you're pumping money into water on the one hand, specifically in communities, let's say for infrastructure, but on the other hand, approving federally and provincially these big projects that then negatively impact the environment and water. So those two, like to me, it's kind of a no-brainer to kind of realize, well, you're pumping millions into this, and why are you approving these projects that are then going to contaminate the water? Ingrid gave a lot of examples of where that's happened. So when I look at that Sustainable Development Goals, I'm thinking Canada isn't really anywhere close to that, because they're not really thinking, I think, in a holistic or integrated manner, that how do they actually kind of work together? And if you're going to try and realize this goal, but then you're not, you're doing something that's completely opposite in another goal, you're actually going to undermine the first goal that you were trying to deal with, if you know what I mean. Like it's kind of blowing my head as I look at these and see how Canada's doing. The other is in relation to energy. So how Canada will be ensure access to affordable, reliable, sustainable, modern energy for all. So kind of what that means, that's not going to be emitting carbon and such. So essentially, what that's kind of meaning in Ontario and other places is nuclear energy, which is usually problematic for Indigenous peoples because it produces waste, and they want to bury the waste in the Canadian Shield where Indigenous people live. So that kind of solution ends up being a major inequity issue for other people, right? So I don't know if necessarily a lot of these solutions are kind of peeling back the layers to reveal the inequities, the injustice, or the racism of these particular goals and solutions. So yeah, I don't have time to go through all of them because I started to, and it was just kind of frustrating me. There was so much that I see that there's so many contradictions. I'm like, you want to do this, but then you have the healthy environment, healthy economy plan, like Canada's climate change plan, and this really shooting for prosperity, partly to sell it, yeah, I guess, politically to people. But it's one of those things where you can't have your cake and eat it too. You can't keep pushing. You're seeing this also with COVID recovery, right? COVID recovery is major industrial development for jobs and that kind of thing, without seeing that climate change is one of the underlying causes of the pandemic in the first place. Like, it's kind of drives me crazy. But on the upside of things, so Claudel already talked about this, is because both of us were on the panel. I can't remember. I would remember if Ingrid was on there. So maybe Ingrid hasn't been part of the group of folks that have been assembled to provide advice on the development of this national health strategy, which was actually a recommendation from the Lancet report, Canada's Lancet report in 2021 that Claudel was one of the lead authors for. So that's kind of interesting, but participating in that, it seems to me like most people get it. They get it. They get that inequity is an issue. Claire talked about some of the things that people are talking about those. They understand, like, you need to have an intact kind of green, for lack of a better word, environment in order for people to be well. It's just, how do you kind of realize that at a very high level? So I might look at it and be kind of dissatisfied because it's so high level, I can't relate to it anymore. Like, communities might have a hard time relating to something that's so high level, because you're trying to capture everything that people said, but at a level where you can capture it. So, but I think it's a positive move forward because it's going to put it in the radar. It's going to put it there in people's radar, and then you start fleshing it out once it goes out for public input. Where I think there's another area where there's potential is the climate science plan at 250, where they are talking about health and adaptation strategies. There is a specific component related to Indigenous peoples, and partly it's related to what I said before. People just didn't really do that kind of research 10 years ago because they didn't ask those questions. So now it's trying to address that kind of gap. What does that look like? The co-production of knowledge. How do you work with Indigenous knowledge and science in order to, answer some of those questions that are important to Indigenous communities. So so that plan's been out a while, and there's actually a meeting on Monday I'm supposed to be at where we're talking about this. How do you realize this? How we're going to be able to figure that out in 3 hours? I don't know. And how many people are going to be there? But at least the ideas are there. Like, to me, like the rhetoric is there, but it's just, how do you realize it in real life? What does this mean for actual communities? Can they relate to any of this? It's very conceptual and abstract. And how can they then relate to it? And I'm just going to give one more example here, and then I'm going to stop and we can continue the discussion. Is so one of the commitments that Canada has, also related to United Nations and other Sustainable Development Goals, is the nature-based solutions. And so the nature-based solutions is kind of all the rage in a lot of places, but Canada's approach to it in the what we just call the HEHE plan, the Healthy Environment, Healthy Economy plan, is pretty much almost, it's basically an amping up of what they were already doing. It's basically it's like planting trees, and that, like, Canada was already doing that. Like, that was already happening. So I haven't really seen anything like really innovative and creative in that particular plan in relation to nature-based solutions, but also has the potential to impact Indigenous peoples, because where these nature-based solutions exist is where Indigenous peoples' treaties and exercise of land rights happens to be. So if you're not consulting and engaging with that, then you're going to create these further inequities. So it's one of those. Actually, we just finished publishing a paper on that. It just came out yesterday with a number of scholars about what the limitations are of the nature-based solutions, because it's not considering particular interests. And I was excited too, but then I read it and I went, well, I'm kind of disappointed. This is just more of the same. We need to actually be transformative. That's what a lot of this is calling for. The Sustainable Development Goals is calling for transformation, that you're really going to be imaginative and creative and think of different kinds of solutions that are going to have an impact that people can relate to. And I don't see that there. It's just sort of like, kind of like more of the same and hoping for the best. And others have said that's not going to happen. Like, you actually have to think and be differently, and people have to be able to relate to this. I'm gonna stop there. Like, so there's a lot that's frustrating me, but there's also the potential. There's also the potential for, and I think what needs to happen is more involvement of people who like the people on the panel who go beyond the abstract rhetoric and whatever else to sort of make it real in people's lives, and make sure that input is sort of there and people have a contribution to make there, because then you know whether it's actually going to work or not. Then you have this ideal, does it actually connect to like real people? Can it be acted upon? So I'll stop there.
Yeah. Thanks so much. I think I'm going to jump right into the next question for Ingrid, because we're talking about tangible action, and she has been a supporter and also a leader in sort of focusing on passing the bill of Bill C-226. So I want her to speak more on that and tell us what that bill means to Canada and how that sort of push forward this tangible action that Deborah was speaking to, and how it will help and how we can do our part also.
Well, the bill has been an extremely long journey for me. It started with a provincial bill, a Nova Scotia bill, that I collaborated with then NDP MLA Lenore Zan back in 2015. We wanted to address environmental racism by introducing this bill, and the bill went to second reading, but it didn't go any further, and she reintroduced it several times since 2015 up until 2018 when she switched over to the Liberal Party. And then in 2020, February, just before COVID hit, Lenore contacted me and she said, why don't we turn that Nova Scotia bill into a federal bill? And I said, yeah, that sounds great, because we could address cases of environmental racism across the country, not just confine our work to Nova Scotia. So it was introduced on February 26, 2020, and then it went to second reading. It was approved at second reading by all political parties except the Conservatives. But all we needed was the other three parties. Then it went to amendments where people can kind of share how they think the bill should be modified. And it was approved there by everyone, all except the Conservatives. However, all we needed was the three parties. So it was on its way, I think, to Senate. you know, when it goes to Senate and maybe there's another stage, I think third reading, there's a great likelihood that the bill can turn into legislation. So we were all very excited. And then when the snap election was called, it died on the order paper, just like every other private member's bills. So we were like, oh, what now? What are we going to do now? We were hoping that the new Minister of Environment, Stephen Guilbeault, would introduce, which is what he committed to, introduce a government bill, which he's still going to do. But thankfully, Elizabeth May, late last year, suggested that she would resurrect the bill I talked about that Lenore introduced, the federal bill, which was Bill C-230. And she did. On February 2nd, Elizabeth May, Green Party MP, resurrected Bill C-230 as Bill C-226. I think a bill is important. I think a bill is, in addition to grassroots community mobilizing and marches and petitions and organizing, I think having the first environmental racism legislation is very important. Particularly what this bill says is that for the first time, the government would be required to collect statistical data on the links between race, toxic burdens, and health. And you know, with the Nova Scotia bill, we weren't as succinct as we were with this bill. I think this bill is much more robust, but we know in Canada, we do not collect disaggregated race-based data, right? Unlike the United States, where the United States could say things like, Black men have higher rates of prostate cancer than white men. We could never say that in Canada because we don't federally collect race-based, disaggregated race-based data. But this bill indicates that they are required to do that. It talks about providing financial compensation to communities. It talks about addressing cases of environmental racism across the country. It talks about consultations, meaningful consultations with communities impacted. This bill is a great bill. It's a bill that has teeth that, to me, could make a real difference in addressing environmental racism. So I am, in addition to my Enrich project, I'm also the co-founder and co-director of the coalition, the Canadian Coalition for Environmental and Climate Justice, which I co-founded in December of 2020. We brought together probably over 50 or 60 different organizations in the environment and climate sector: David Suzuki Foundation, Eco Justice, Climate Action Network, faith-based organizations like Kairos, I think the Church of God, on and on. We brought together a lot of organizations. And specifically with respect to the bill, we are now just about to launch a campaign to support the fast tracking of the bill, because when Elizabeth May reintroduced the bill, which is really exactly the same bill as Bill C-230 that Lenore introduced in 2020, it's the exact same bill. So we're like, well, why should it go through all the same stages? Why does it have to go to first? Well, it has to go to first reading, but why does it have to go to second reading and third reading? Can we fast track it past the Environment Committee and have it go straight to Senate? So that's what we're trying to focus on. So we are in the process with my coalition to launch a campaign that would try to fast track it. Our coalition members are engaged in a number of activities, Twitter campaigns, hashtags. I just recently finished a press release that I'm going to send out to the media next week. There's a letter writing campaign. I hope to meet with Rosa Galvez. She's a senator. And in 2020, I think she wrote a really great op-ed around environmental racism and the need to address it. So I would like to meet with her. So many of us are meeting with MPs. Some people on the coalition want to meet specifically with conservative MPs because they have failed to support this bill. So that's really the sticking point right now. So we are hoping that this happens because I think it's really important to have legislation. But in the meantime, we're also going to support or encourage the new environment minister to introduce the government bill that he promised. Right? We don't want to let him off the hook, you know, because if you're committing to something and if you promise to do something, you should do it. And, you know, I hope Elizabeth May's bill succeeds, of course. But if it doesn't, I would like to have a backup, and that backup would be Stephen Guilbeault's government bill. Government bill, I'm still trying to figure out the difference, but the differences between a private member's bill and a government bill. The government bill is obviously created by the government, not by another political party. And in some ways, I feel that it's more robust because they have to see it through. With a private member's bill, people can just go about their business and forget about it. You know, you could pass that bill, a private member's bill, and nothing could happen from it. Nothing can come of it. Whereas a government bill, there's much more, what's the word? There's a much more commitment by the government to address it. So I'm going to be involved in this campaign to support Elizabeth May's bill, but a little later on, perhaps in the late summer of this year, I'm going to do a similar campaign where I try to encourage the new environment minister to introduce his bill and keep his commitment. And then there's also CEPA, the Canadian Environmental Protection Act, which I've always had issues with because I don't feel that it centers the experiences of Indigenous and BIPOC communities at all. It talks about everybody in Canada has a right to a healthy environment, but my argument is, yes, everybody has a right in Canada to a healthy environment, but some communities don't seem to have that right. And the communities that are most vulnerable, Indigenous communities, BIPOC communities, don't seem to have that right. So I've always wanted CEPA to put that in, right? To say, but Indigenous and Black and blah, blah, blah. They've never really done that. It's this whole kind of notion that we all have a right. My point is, yes, we should, but some of us don't, and some of us are much more vulnerable. So I think with this new version of CEPA, they've done that, I believe. It talks about vulnerability, it talks about the specific communities. So as long as it does, I will support it. If it doesn't, I'm not going to support it the way it is. But I'm also involved in a campaign that will support CEPA moving forward.
Thank you so much, Ingrid. With one eye on the time, I'm going to quickly move to Claudel. I just want to tell the audience, since we're trying to manage time, if you have questions, please put it in the chat and we'll try to, we'll do our best to get the questions across. I want to move to Claudel's work where she has globally and also locally sort of advocated for climate action and at the intersection of healthcare. To one of the major and admirable efforts is raising awareness among healthcare workers and also among communities. And as you know, COVID-19 is a zoonotic disease that jumped from animals to humans. So it's really important to raise this awareness. So I was wondering, given your background, what do you think should happen in terms of building awareness and what efforts are happening within, say, Quebec, and then maybe what efforts should happen globally more than we're doing already?
This is a big question. I think one thing we should be doing more is having healthcare professionals that are engaged in the climate discussions. We've known for a fact that climate change has been left out of the medical curricula. And I mean, I'm not even talking about nurses and OT and ergotherapists, but it's not been taught in medical school. We've been making some slight changes in the last couple of years. So like, for instance, in my own university, I've given the first class on climate change and health, which, I mean, it was an hour and a half for pre-graduate students that were enrolled in medical school. This is a start, but this is not enough. I mean, we're talking about the thing that's going to influence the health the most of the people in the upcoming years. So there's an effort here to accelerate climate change education, especially in health faculties, so medical school, nursing school, etc. One of the reasons is that we know the healthcare professional are some of the most the people that we trust the most in the community and in the public sphere. So there's a recent survey that came out and people say, you know, who would you trust most? Journalists, doctors, politicians, police officers, and, you know, on top of the list are doctors and nurses. So I think there's also, when you look at what we have as our own responsibility is to understand that we have this privilege of having a voice. We also have this privilege of being able to tell stories. We know who's facing climate change and who's vulnerable to climate change. It's people we see every day in our clinics. So I think it's important to translate those stories because we have a privilege, we have a voice, and I think it's important to acknowledge that. And one of the other thing we need to do is at least to be a bit current between what we do and you know what we say and what we do. And for me, that also means that looking at the impact of the healthcare sector on the environment. We know that if healthcare were a country, it would be the 5th largest emitter on the planet. So the healthcare system in Canada globally is, in the country is responsible for approximately 5% of our GHG emission per year. And that's not counting the amount of waste that is generated by the healthcare system, energy waste, food waste, plastic waste. And, you know, we also have a healthcare system that is driving people sick. We do exams over exam, blood work just to do blood works. And I mean, there's a whole movement in building up of choosing wisely and making sure that what we're treating is the right treatment for the right person at the right time, but also making sure that we don't do overdiagnosis. So I think those conversations need to happen simultaneously. But also, if you want to be current in front of the population and tell them, you know, you should be doing X and Y for the environment, I think we should also look at what we're doing from the inside. A friend of mine who's doing surgery told me, like, she's like, every year, every day at the OR, I put so much stuff in the trash that when I go home, it doesn't make sense to do compost, just because, you know, I generate 3 trash per day of waste in my OR. So I think if we are able within our healthcare facilities to decrease our imprint, patients will benefit it and health professional as well. So in terms of strategy, luckily we have a leader around the world, and this is the UK. So the National Health System, which is the NHS in the UK, has a strategy to be carbon neutral by 2040. We've been trying to advocate around the government of Quebec to do the same. They were mostly not listening to us until a few weeks ago that we got signal that they've heard us a little bit, and they've got in discussion with people at the NHS in the UK to sort of try to see what could be done in Quebec. There's a discussion ongoing right now in Canada around how do we get there to have a coherent strategy to decrease our input in the healthcare system. Stephen Guilbeault, in the last conference of party, the last COP in November, took the engagement and signed the WHO initiative to increase resilience in healthcare facilities and decrease our input, our footprint. So I think it's moving a little bit, but there's definitely, I think, 2 things that need to happen: healthcare professional becoming engaged, and making sure that we have a bit of coherence between what we are asking and what we do. And that means medical education and decreasing the footprint of our healthcare institutions.
Thank you so much, everyone. We have 1 minute left. I want to sort of end with, there's one question from Tim. I'm just going to quickly read it out and then give an opportunity for the panelists to answer. So if you all, so is there a risk with the thawing of the permafrost that there will be release of dangerous pathogens? Are the Arctic nations prepared for this threat? I will open it up to everybody to answer. It's also in the chat if you want to read it. Essentially, if I was to simplify it, would be that because of the global warming, there will be release of pathogens, and as communities prepare for it, how can we face this threat?
I wish I could answer.
Go ahead.
I wish I could answer the question. I might know better in about a week, because I'm part of the adaptation panel for climate choices, and actually we're to review a report that the committee's meeting on the 21st. So I have it, but I haven't read it yet, and it's on the impact of the permafrost. However, what I will say, just builds upon what Claudel has already said, is they weren't so focused on health for that one. It was more on infrastructure. So it tended, like, there's this huge bias that Claudel talked about, and it was focused on basically what's going to be the cost of infrastructure in the north with the melting permafrost, because governments tend to be concerned what's going to cost them a lot of money. What Claudel's talking about, it does cost a lot of money, but you can also save a lot of money if you pay attention to health and climate change in a particular sector. So I apologize. I should have read the report. If I knew the question was coming, I would have got up early this morning and read the permafrost report. Maybe I would have an answer to that, but it has to be reviewed and then it would be released. I think they're about to release a northern one that I think deals with permafrost, but the whole report was on permafrost. So apologies for that, but I will say one is coming, but I will say, having been part of that process, there's a huge bias in it that Claudel's talked about. It like they weren't so much focused on health. It was more like what's going to cost governments a lot of money, and that was infrastructure. But so hopefully I can send a note or something in another week when I've read the report and tell you what it says about that. So it's a good question, and I apologize for telling you that teaser, but not actually having the answer.
Thanks so much, Deborah. So we are somewhat over time, so we have a bit of a fireside chat with the students, so we're going to move on to that. I want to thank the panelists publicly, but please stay on, don't leave. And I want to thank everybody who joined us, and this was very eye-opening and also sort of activated us to care more about climate action and communities that are affected by it. So thank you all.